By 2030, Uganda hopes to have 95% of people living with HIV/AIDS knowing their status and the disease eradicated. To make this vision a reality, the Ministry of Health adopted an innovative approach, that is, introducing HIV self-testing to both the public and private sectors. However, there were some challenges, such as the slow adoption of these life-saving products in the private sector due to supply and demand barriers. To address this, the Ministry of Health, with the generous support of the Children's Investment Fund Foundation, CIF, and in partnership with Population Services International, PSI Uganda, launched the Strengthening HIV Self-Testing in the Private Sector SHIPS project.
Contains everything, so maybe I just need to take you through how to use it. Yeah, but it contains everything. You don't need to buy a separate buffer or precursor. In here, this is where the actual test is. This is the one you end up placing in the buffer solution.
So if I just spit on it, can't it work?
No. It works with your antibodies, and you can only achieve those by swabbing your gum to extract some antibodies. It doesn't use saliva. Yeah, so don't spit on it, please. If you can't call this line, then they also have a WhatsApp. You can just WhatsApp this number, and it can also refer you to where you will get further help.
Okay, thank you so much. I will take this.
Our relationship with SHIPS project from PSI, it has helped us to sell more quality assured kits, and this has really helped us because from the trainings we attended with PSI, we have been able to augment our knowledge on use of these kits, which has in turn empowered us to explain well to our customers the use, the referral methods and all that, which has really been good for EcoFarm in terms of sales for the HIV self-testing kits. Then also we have had more awareness spread among the users of these self-testing kits, which can be reflected from our sales, whereby you can find that in the past we have been selling around 700 kits on average in a month as EcoFarm, but ever since we onboarded with the PSI project, we have now moved to greater numbers like 2,000 kits on average in every month. Then also we have more online sales of the self-testing kits and also generally sexual reproductive health, self-care products, where you can find someone calling in for a delivery of a self-testing kit, which just goes to show you how much more awareness has spread for the use of these kits. Then also, we were introduced to a concept of bundling from the SHIPS product, where you take a self-testing kit and you add another sexual reproductive health self-care product. And this has helped to boost our sales because as opposed to only selling a self-testing kit, you can suggest it as a bundle to a consumer, and that way they can take the kit in conjunction with another self-care product.
The pharmacy activations have enabled us to reach or access quite a number of people in the public to whom we've given information regards the quality assured kits, and also we've been able to give them information on how to use them and the different platforms through which they can access the kits. What happens on the activation is that they are fed with the knowledge on how to use them, the different types. When they need them at that particular instant, they buy them, which drives sales to our pharmacies. However, in the case that they cannot access them at that time, they still get to access them on our online platforms of Jumia and online business still, which has increased our sales towards the online. It's been a positive impact for us in regards to sales.
Through the partnership, we were able to discover new opportunities for us in the market. We were able to identify some things that I would call loopholes that we have been able to cover up, and we are better aligned. Before we started the partnership in 2022 with the PSI team, we had a great deal of trouble penetrating the market. Mainly because there was scarce information about HIV self-testing kits in the market among the masses, to be precise. But with the partnership, we were able to have a couple of demand creation activities. So we saw that we rose from an average of 1,400 kits sold per month to about 4,800 averagely. So that was a big win for us, and because of that surge, it was unexpected. We went in a stock out, so the partnership also helped us to forge better and realign our scheduling experience as regards to stock. It also helped us keep in sync with our customers. We had these frequent engagements with them, so we're able to identify what issues they had, what concerns they had, and we're able to address them satisfactorily on the end of the customer, but also on a beneficial end for us.
Omugaso gw'essaako kiti eno ekintu kyali kisinga ddala nti abantu abasinga babadde batya okugenda mu gundi okwekebeza mulwaliro okwekebeza abantu abasinga okuteekereza kizaabwe naye ekintu kyako nti gwe wetegeera wekka ng'omusawo w'obulamu bwo kinakalabako kinagenda waka neekebeza nyenteekaali after dakiika gaali 2 lintegedde bwenyimiridde nze zekka nga tiri muntu mulala yekka ategedde bwenyimiridde era nawulira bulungi nnyo neewuunya nnyo okubanga enkola eyo ate ezze wano mu Uganda ate nga nnyangu nnyo kyampa essanyu.
Today, I got to find out about the HIV self-test kit, and I think it's important because it promotes confidentiality of your HIV test results. 1, 2, it helps you to conveniently find out your HIV status, and it helps you do away with the long lines in the hospitals before you find out your HIV status.
From this partnership, we're able to ably identify that stigma is a big issue in society. It is still a big issue. You could think that in this day and age, people are not having challenges around stigma, but it's still a big issue. So that is why we do not find many people going to line up for HIV tests in the public facilities. So bringing HIV self-tests to their convenience, yes, it has helped a great deal. We find that now that they know that the HIV self-tests are existing, particularly I'll speak for Oraquick, we have seen the numbers rise. So the demand, the knowledge that has been put out there has been effectualized in the increase in sales.
So online pharmacy and the digital marketing were working hand in hand together in the PSI project to ensure that the digital marketing ensures uptake of the service, whereas online pharmacy was to create convenience in the way that patients communicate with the pharmacies and the pharmacies communicating with the patients to deliver to them HIV self-testing products.
Here at the call center, we've received over 80% increment from about 300 calls before the SHIPS project to about now 1,193 calls. So there's been a very great improvement ever since we undertook this project, and we are grateful and very excited to be supporting HIV self-testing in the private sector.
According to our projection, we have doubled. In terms of uptake, we've registered 20 times more than the initial numbers we are receiving from the outlets we support. We work through the pharmacy channel, and that's retail pharmacy. So we know that the work we have done together with the partners and the lessons we've gathered through the demand creation work and through the service delivery work has gained us good reach, and we have achieved more than what we projected to do. Some of the learnings I can share: 1, through our digital campaign, it reaches more men than the females. So more men are free to interact with the digital channels that we work with compared to the males. That is in terms of demand creation. And in terms of the physical activities, we've learned that the joint work we do with the pharmacists, the joint work we do with the distributors, with the guidance from ministry and PSI, we are able to reach greater numbers at a lesser cost rather than doing it alone as PSI. It's very important that not only in this pilot but any other project targeting the private sector, working in partnership with other key players in the market or in the space you are implementing or supporting is very, very important for you to achieve bigger reach, bigger milestones, and better impact in the country.
We're also looking at how can we ensure that there's local funding for this initiative. It has given us a number of lessons, and we want to take those lessons to expansion of self-care within Uganda for the HIV self-testing, especially in the private sector. So the critical next step is for us to work with all the players, the manufacturers, the distributors, and the different implementing partners to come up with a roadmap for the private sector. Because we know the private sector is the way to get this thing moving and make it sustainable. So it's very important that we get everyone on board, work together, and address all the challenges that enable us move to the next level of ensuring that HIV self-testing is sustainable.
So HIV self-testing is an additional approach to HIV testing, where individuals do their own tests. You collect your own sample, interpret your own result, you do it in private, and it provides that confidentiality. But it's also cost-effective in terms of people not moving from place to place, looking for the kits or looking for the service. Yeah, so in terms of programming, it's very significant in a way that it helps us reach those people that would have otherwise not reached if we only waited for them at the health facilities. Subsequently, we really want the private sector to be the driver of this HIV self-testing. Yeah. As the acronyms sound, strengthening HIV self-testing in the private sector, it's been a game changer in terms of us understanding the private sector deeply and also more deliberately creating and strengthening that partnership between the public and the private sector. One of the things that have actually happened quite significantly is that close collaboration, especially between the private sector providers, the owners of the pharmacies and the clinics, and also for them getting to know and understand the Ministry of Health public policies, especially on HIV testing services, but also the fact that now they can give information. They are not just after sales, but they can provide information about self-testing, about how the kits work, how the kits should be used, and what the people should do when they test positive and what they should do when they test negative. So information is easily passed at that interaction when people are picking the kits from the private sector, which wasn't there before. Yeah, so this is a very important lesson for us to learn.
As PSI Uganda, we aim to ensure that Ugandans live healthier and happier lives. PSI basically identified self-care as an innovative approach, and working with the Ministry of Health, use the human-centered design to ensure that we can deliver self-care. PSI is basically guided by 5 pillars, which we have used a lot in this program. One of them is partnerships, ensuring we are working with other people. Led by the Ministry of Health, we are working with Baylor, we are working with CHAI and other partners in this space. Use of digital technologies, this has been very important in this project, ensuring that since this is self-care, people should be able to access information when they need it. And these digital technologies have enabled people to get the right information when they need it in their comfort of their homes, and also to access the product.
As PSI Uganda, we extend our heartfelt gratitude to the Children's Investment Fund Foundation, CIF, for their unwavering support and belief in this life-changing mission. Because of their generosity, we achieved many strides, such as reaching 37,792 people with HIV self-testing and sexual and reproductive health information through physical, pharmacy, and community activations. 1,805,764 people through digital channels, and there was uptake and purchase of 11,349 approved HIV self-testing kits, which translate to 145% of the target.
The project leaves behind a legacy of change. SHIPS catalyzed the growth of the private sector market for HIV self-testing with a public health impact by resolving key barriers and failures that limit the growth of the market, engaging stakeholders to develop a consensus agreement on market growth, and effectively coordinating with multiple donors and implementers across HIV self-testing realm to optimize investments. The SHIPS project is ultimately enabling the development of a private sector market roadmap, which is a positive nod to SAFE and PSI Uganda's health system strengthening efforts and the Ministry of Health's commitment to improving the health and well-being of all Ugandans.